Good morning everyone, we are Group 2. The members in Group 2 is Dan Zixuan, Chua Xingtian, Ho Peijun, and Dan Lihang. Today, we want to share that mental health is a serious issue. So, what is mental health? According to the World Health Organization (WHO), mental health is a stage of well-being in which the individual realizes his or her own abilities, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. In this era, mental health has become a serious issue. Types of mental illness are anxiety disorders, behavioral and emotional disorder in children, post-traumatic stress disorder, depression, and others.
In the mid-19th century, William Switzer was the first to coin the term mental hygiene, which can be seen as the precursor to contemporary approach to work on promoting positive mental health. Isaac Ray, the fourth president of the American Psychiatric Association and one of its founders, further defined mental hygiene as the art of preserving the mind against all incidents and influences calculated to deteriorate its qualities, impair its energies, or derange its movements. In American history, mentally ill patients were thought to be religiously punished. Dorothea Dix, 1802 to 1887, was an important figure in the development of the mental hygiene movement. She endeavored to help people with mental disorders and to expose the substandard conditions into which they were put. From 1840 to 1880, she won over the support of the federal government to set up over 30 state psychiatric hospitals. However, they were understaffed, under-researched, and were accused of violating human rights. Emil Caprin in 1896 developed the taxonomy of mental disorders, which has dominated the field for nearly 80 years. At the beginning of the 20th century, Clifford Beers founded Mental Health America, National Committee for Mental Hygiene. In 1908, he opened the first outpatient mental health clinic in the United States.
There are some programs to address the issue of mental health. For example, MySport post-traumatic stress disorder course, BREATH programs, and Reach Out Worry Times. The MySport post-traumatic stress disorder course helps adults aged 18 years and over to manage psychological and emotional symptoms. MySport is funded by the Australian government and contracted by the Department of Health as a regular clinical service. After that, the BRAVE program is designed for children experiencing anxiety to help them develop skills and coping strategies to improve the quality of their lives. In addition, Reach Out Worry Time is an application which helps you to assign a time of day to worry about issues and leave the rest of the day free to get on with life. It is based on cognitive behavioral techniques used by health and well-being practitioners to assist people with anxiety and stress.
Since mental illness becomes more common and serious, some practices have contributed to preventing it from widespread. The relevant practice can be divided into government and non-government. Government relevant practices are mental health services which are organized with a focus on caring for people in their own homes as far as is safely possible. Mental health service includes crisis resolution and home treatment team (CRHT), early intervention program (EIP), and assertive outreach team (AOT). After that, for non-government relevant parties is the Mental Illness Awareness and Support Association (MIASA). The objective of MIASA is to promote awareness on the importance of mental health, to address and clarify misconceptions on mental health issues and conditions while simultaneously providing support for peers and caregivers through its various programs and support initiatives. Being peer-initiated, MIASA has a strong foundation and also purpose. It offers a holistic solution, not only from the medical perspective but of spirituality being a key component, highlighting the critical importance of the recovery model focusing on empowerment, autonomy, and right-based approach.
According to our work in data 2018, over 970 million people in the world are affected by a mental disorder such as anxiety, depression, alcohol use disorder, drug use disorder, bipolar disorder, schizophrenia, and eating disorders. Mental health issues are one of the leading causes of disability across the globe, whereas they are the #1 reason for disability in the United States of America. In Malaysia, the National Health Morbidity Survey (NHMS) in 2015 reported the prevalence of mental health problems amongst adults and children was 29.2% and 12.1% respectively. However, in January 2021, 41% of adults reported symptoms of anxiety or depressive disorder, a share that has been largely stable since spring 2020.
According to the data just now, mental health issues are becoming more and more serious in today's society. So, we should learn how to prevent and face our psychological problems to live a healthy life. If people around us have psychological problems, we can also recommend them for professional help like the one mentioned above. There are 2 questions about mental health. Thank you.